Welcome back. I'm your host, Stephanie Michele Sweigart, a licensed school-based SLP here in Los Angeles, California, and I'm here with SpeechTherapyPD.com. All right, guys, Autism Acceptance Month is upon us for the whole month of April. This was formerly known as Autism Awareness Month. And the purpose of this month is to really bring public awareness to celebrating the differences, accepting and including autistic individuals everywhere. So we know that every day there are opportunities to empower autistic individuals, but for 30 days in April, as the Autism Acceptance Month mission states, this is the time to focus the efforts towards educating a new generation in ways of fostering acceptance and kindness towards the autistic community. So this is a great time to welcome our guest that we have here today, a very special guest that we have to talk to us a bit more about this. We have Dr. Mahshid Namazi, who is faculty in the School of Communication Disorders and Deafness at Kean University. She is an ASHA certified multilingual, so we have Farsi, French, English, and Spanish, amazing, a pediatric speech language pathologist with over 26 years of experience in a variety of different settings. She's been a clinical supervisor as well. She conducts research and other scholarly activity in multilingual and multicultural aspects of speech, language, and communication development and disorder, as well as interprofessional practice and autism. So Dr. Namazi also teaches doctoral, master's, and undergraduate courses in language development, developmental language disorder, bilingual language development, autism, and research design. I do not know how she has time to be here with us today, but welcome, welcome. Thank you so much, Dr. Namazi.
Thank you so much, Stephanie, for that introduction. And this is talking about autism and neurodiversity is one of my loves, so I will always make time to talk about that.
Thank you, absolutely. And we're gonna dive right into that. Dr. Namazi, we know that you have a course on SpeechTherapyPD.com called Neurodiversity and the School SLP. I watched this course. It's a 2-hour course, rich with information and handouts and slides. And you had so much to share that you're like, I don't even think I can fit it all into the 2 hours that I'm with you guys, but I'm still going to give you, a plethora of information and more slides to come. I mean, you're just so generous in your wisdom and everything that you're sharing. And we know that the neurodiversity movement is a hot topic. This is, as you mentioned, a paradigm shift in how we are looking at autistic individuals and the way that we're providing support, whether it's through assessment or through therapy. And you state so beautifully in your course that we need to look at autism from the inside out, not the exterior of the individual. And you say that autistic behaviors are human behaviors, and autism is a difference, not a disorder. In your course, just to bullet point some of it, you describe the neurodiversity paradigm and the social model of disability as they apply to autism. You identify assessment practices that utilize the neurodiversity paradigm. And I think so many, we kind of come to this place where so many SLPs and even SLPAs, as we're looking at goals, we are trying to figure out what are some of the best ways to write these goals. How do we write neurodiversity affirming therapy goals? So that's what really leads me to the golden question that we have for you today. And that is, what would be, if you can, share maybe 3 takeaways that clinicians should know when writing non-ableist goals that are in line with the neurodiversity paradigm?
Absolutely. Thank you, Stephanie. That is such an important question, and it is definitely the main question that speech language pathologists will often ask, and it's an important one that needs to be addressed. Now, before I talk about the main takeaways in terms of writing neurodiversity affirming goals, it's important to talk about sort of a foundation, a sort of framework or theoretical foundation that needs to kind of shift. Now, as speech language pathologists, we are pretty much all trained in a medical model. And the medical model views disability and disorder as something that needs to be cured. So if we want to embrace autism as an identity, it's really difficult to practice purely from that medical model. Yes, we do need, for now, the only way folks can get a diagnosis is through sort of that medical model. But once we've passed that diagnosis point, if we want to practice in a neurodiversity affirming manner, then it's important that we make a shift to a social model of disability. That disability really is a social construct. And it's important for me to say that the neurodiversity framework does not maintain that autistic folks are not disabled. Autistic folks, in fact, are disabled by the social environment, right? So they live in a neurotypical world that makes it very hard for them to function in the ways that they need to function in their own lives, in their work settings, in their personal lives, when they go out to do the grocery shopping and so on and so forth. So that shift is really important. So that would be my main message, is that that shift needs to be made. And so in order to really be able to internalize that neurodiversity affirming therapy approach, as opposed to it just being kind of something we do, but it's really something, it has to be something we really believe in. So I would say first and foremost, in terms of being able to write non-ableist or neurodiversity affirming goals, we really do have to think about what is best for the autistic individual. So are we writing these goals in order to empower and support the autistic individual, or are we writing these goals in order to make everybody else comfortable? So what I mean by that, for example, an eye contact is a really big one in sort of the neurodiversity framework as being a very ableist goal. Often eye contact is kind of written as its own goal. And the question that I will, ask folks who do write that goal is, what is it that you want the autistic individual to do that requires that eye contact? Is it that you want they need to respond to, a bid for communication? Is it that they need to answer the question? Is it that they're initiating something? And you need to know, as a neurotypical person, you need that eye contact in order to know that they are listening. So I think that's really, really important. Anytime we're writing a goal that feels more like we're trying to change the the core autistic traits and make folks more neurotypical looking, we really have to ask ourselves, is this necessary? Because what happens is we are then not actually accepting the autistic identity, and we are sending the message to the autistic individual that your identity is not valid, that the way you interact is not valid. So that's sort of a really big one. The other thing that I tell my students who are in our Neuro Allies program, which is a neurodiversity based sort of specialization in autism that our speech language pathology students who choose to can pursue, is that above all, do no harm. Don't do anything to an autistic child that you would not do to a neurotypical child. So that includes not using punitive consequences. That includes not using food or things that they enjoy as sort of a carrot that we kind of dangle. So we take these things away from them, and then we insist that they do XYZ. And then if they do XYZ, then they can have the thing, right? That the food that they want, or the thing that they enjoy playing with. And the problem with that, first and foremost, is that it is not honoring and respectful of that individual. And Secondly, it's not helpful in terms of generalizing learning. So when you're learning, what the research shows is that when kids learn in that way through a lot of extrinsic reinforcers, they like food, like other objects, they don't actually internalize that learning, and we're making the learning far less efficient. So the key is to find the things that motivate the autistic individual, as Dr. Prezant would say, their enthusiasms. What are their enthusiasms? And actually incorporate those enthusiasms into the therapy. So that would be the second main one. And then one of the really important things about the social model of disability is that the environment is something that does actually make someone much more disabled than they are. And so as speech language pathologists, we really need to focus, and I think we do focus on the environment, but I think we can do a better job of focusing on environmental barriers. And environmental barriers can be the physical stuff that we think about, the lighting, the room, the space, but environmental barriers can also be the individuals that are interacting with the autistic person that do not really understand how that individual communicates. And so they're not sort of bringing out the best communication out of them. Environmental barriers can be light and noise and all of those things. So I think that that's definitely another important sort of focus of the neurodiversity affirming goal writing, is to write goals that focus on the environment. So I can certainly give examples that might be helpful for folks. The other thing I just wanted to say is that we really have to focus on goals around self-expression, right? And as speech language pathologists, we know that's all about communication. So we want our autistic folks to be able to, say no, and not just say no, as in just the word no, but if they are, be able to advocate for themselves when they need supports, be able to tell us, no, this isn't working for me. We want them to be able to let people know when they feel emotionally or sensorially overstimulated, or they feel dysregulated. So those self-expression goals are so important. And we're not going to know what they are until we really take time to observe the person in different settings, to ask them if they can tell us, ask them what their needs are, and so on. So I wanted to just give an example of a 7-year-old.
Please.
Who has a dual diagnosis of ADHD and autism, which we see often. And ADHD also is viewed now through a neurodiversity lens, as is stuttering. That's becoming more and more prevalent as well, because stuttering is not something that can be cured, and it can only be managed. And so that's another one. Dyslexia is also viewed as a different way of being, sort of a different way of thinking. So it isn't unusual that we have kids that have ADHD and autism as a dual diagnosis. So this is a 7-year-old who talks really enthusiastically about tractors whenever and wherever they can. And they also become really frustrated with class assignments and kind of just give up. So, so the way I look at this is, okay, so does this child have the means to let us know somehow that they are, first of all, to identify how they're feeling, to let us know, how do you feel? Like, how am I feeling right now? And that's a hard thing for a lot of our autistic kids, is being able to identify their own feelings. Even for neurotypical kids, it's not always easy to go, well, I feel really frustrated, or I feel really sad. So, so they're just quitting and giving up. And to us, it seems like, it's a behavioral issue, where in fact, perhaps they need help on a question. Perhaps it's, I don't know, the format the assignment is delivered in. Perhaps it's something they don't understand, the assignment itself, or maybe they don't understand why they need to do this assignment. So what would happen, what I think would happen in a traditional sort of setting is goals would be written such as improve expressive and receptive language, engage in reciprocal conversation, maintain eye contact, follow two-step plus instructions. So that would be, those would be sort of the more traditional goals. Now, in a neurodiversity affirming context, we would write kind of different, slightly different goals. But importantly, we also would give access to this student to have, or give them unrestricted access to any and all supports and modes of communication. Mm-hmm. And that's a really key thing that autistic folks are telling us, is that why do we have to do everything independently? Because it is the average neurotypical human doesn't do everything independently, right? And it's an interesting thing, because if someone has a physical disability that requires being in a wheelchair or using a cane, right? Our end goal is not to take the cane away, right? Our end goal is this person will be able to mobilize and get around using a cane. So the key is to always work on goals by giving unrestricted access to supports and all modes of communication. So the goals could be written as identifying their own feelings, right? Oftentimes when we work on emotion feeling goals, what I observe is that folks are working on having the autistic person identify other people's emotions and identify emotions in photos and so on. However, the key is they need to begin by being able to identify and figure out their own emotions and learn either through pictures, using pictures or any form of AAC that they might need, any mode of communication or words, that this is kind of how I'm feeling. And then the other goal that we could write is to understand different perspectives. So again, with perspective, we tend to most of the time write goals that the autistic individual has to understand the perspective of the other, the neurotypical individual. But in this case, it's understanding different perspectives. So this assignment, you're a student in a class and the teacher requires this in order for you to learn X, Y. So understanding those different perspectives, but also more importantly, the perspective of the student who is struggling with this assignment, and having that attitude that, why are they frustrated? There's something about this assignment or this setup that's making them frustrated. So what is it that the child is trying to communicate by sort of just giving up? And then self-advocacy. So being able to say, I need help with this assignment, or I don't understand this question, or so being able to, express themselves in a way that allows us to support them as much as we can. So I hope that's helpful. I'm sorry, it was a very long.
Oh, this is so rich. This is what I was talking about with your 2-hour course. It's just so rich with information. And I'm hearing so many things that are so exciting for people who are listening. I love how we're changing the language that we use, first of all, and looking at that vocabulary, and you spend time on that vocabulary. One thing that stuck out was you said, instead of saying they're fixated on, that fixation on, you're saying it's their enthusiasm, it's their excitement for, and just some of these little things where we can take a look at that. Again, like you say, moving away from the medical model of looking at things. And so now you're talking about, when we're looking at our goals, moving away from the traditional goals. And you do a beautiful job. I think you have a nice chart in your course that says, this is the way that it could have been said, but we can move into now looking at things this way. And again, that's that paradigm shift that needs to happen. And there's a lot of beautiful examples, and you talk about writing goals, and you give examples of that in your course as well. So I just love hearing how we can look at all of this with a new pair of eyes. And really what it's doing is, again, it's that word of acceptance and understanding. It's peeling back the layers of the onion to getting to understand the behavior. And we know that behavior is communication and communication is behavior. So just such rich information that you're sharing, Dr. Namazi. This is wonderful. Thank you so much. I mean, I know you're doing a lot of things. Do you have other resources out there or websites or anything where people can find you, or handouts or anything that people need to know about to further their education on this topic?
Yeah, and one of the things about being a faculty who has to teach who wants to teach and do research is that, that's where I focus my time. But as a scholar, I'm always really welcoming anyone who wants to contact me with any questions. And I think, that's the important thing, is to keep that communication open. We're working hopefully on developing resources, but it's hard to do that when you are sort of full-time training SLPs, doing
A lot of hats.
so it's hard. I read a lot of articles. I stay up to date with what's going on. And I'm always happy to speak to folks individually who want to contact me. And if I can just finish by saying, please presume competence. Please don't assume that a non-speaking autistic individual has no language. And notice that I use the term non-speaking, because really speech is not a requirement for language. So language doesn't need speech. Speech needs language. So the person can have a lot of language in their head that they're not able to get out, but it does not mean that they, so we always have to presume competence.
I love that. And then what we'll do is below this episode, for anybody that's watching, we will have links to any of your websites or emails. I know you offer in your course, if somebody's local, come have a cup of coffee with me. You're very generous with your time and sharing of your resources. So thank you so much. When I hear you talk and I think about all of these things, and how we can all take that extra step to foster acceptance and kindness. It reminds me, I'm not sure if you're familiar, but there's a mindfulness practice known as a loving kindness practice. And it's really a powerful and a transformative tool, because it aims to really increase feelings of caring and feelings of warmth for yourself, but also for other people. And it reminds us that every one of us in this world, we all want to be happy. We all want to live a life that is free from suffering. So essentially, through this practice, we are intentionally seeing the good in others, much like when we talk about a strengths-based approach, where we're choosing intentionally to focus on the positive, right? So that's that loving kindness, is seeing the good. And then the second part is really expressing it. So I just thought, to close out today in honor of Autism Acceptance Month, I wanted to share some loving kindness to autistic individuals everywhere as we close our episode. And for those listening, if you want to follow along, you can do so by maybe placing a hand over your heart center if that feels right for you, or you can even close your eyes if it feels right. But I want to share these words, offering them to the autistic community. And the phrases go like this: may you be safe and protected, free from inner and outer harm. May you be truly seen and heard by others. May you continue to march to the beat of your own drum. May you be respected and validated. May you be celebrated for being your unique you. May you be truly happy and deeply peaceful. May you live your life with ease. May you accept yourself completely just the way you are. And may you accept yourself completely just the way you are for this moment. Thank you. For everybody that's listening, thank you for being here today. If you want to take a deeper dive into this topic, be sure to go to speechtherapypd.com. Check out the course Neurodiversity and the School SLP. And in this course, you're going to learn about the neurodiversity approach to autism. Dr. Namazi begins by covering relevant terminology. She's going to discuss assessment practices that are strength-based and in line with neurodiversity. Neurodiversity, evidence-based therapeutic speech language intervention for the autistic population will be covered, and communication, pragmatic, ethical therapy practices, as well as potentially trauma-inducing practices that SLPs need to be aware of will be shared, and that they need to be aware of when working with this population. All of this is going to be examined in this course. So be sure to check that out. For other topics, when you subscribe to speechtherapypd.com, you're going to get a 1-year access to over 800 live and on-demand courses that are available for you, and you can scoop up those ASHA CEUs. If you are new to speechtherapypd.com, be sure to access a free course. So check out that information below. If you enjoy this episode, go ahead and give us a thumbs up, subscribe to our channel, and feel free to leave comments below. We want to hear from you. We will be back here next week as we are answering more of those golden questions that SLPs and SLPAs are asking, and we are bringing in those industry-leading experts to give you the answers you need to build your know-how and step up your game.